Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson. And today we have a special guest. We have Dr. Tola T'Sarumi, who is a double board certified psychiatrist, an addiction psychiatrist at Mass General Brigham, Mclean Hospital. She's a faculty of psychiatry at Harvard Medical School and an emotional wellness strategist who is passionate about mental health, women's issues, overcoming the stigmas associated with mental illness, and weight management, which definitely affects self-esteem, leading to negative impact on mental health. She helps professionals and physicians overcome addiction, depression, and suicidal thoughts. She is the medical director of Aesthetic Plus Mind MD, where she blends mental wellness with aesthetic treatments, offering a holistic approach to personal well-being. Her use of non-invasive, non-surgical transcranial magnetic stimulation, also known as TMS therapy, has been welcomed by patients looking for a non-drug, non-shock alternative for the treatment of depression and many others. She has been featured in Medscape, the Canadian Medical Journal, the American Association of Publishing Leadership, the American Journal on Addiction, Health eCareers, The Washington Post, Authority Magazine, Thrive Global, and on many podcasts. And without further delay, let's welcome Dr. Tola.
Hi, thank you so much. Thanks for having me.
I'm so excited. I know it's been a long time for you, for us to get you on the show, and I'm really interested for you to share some of the non-surgical, non-invasive treatments that you have for depression and wellness and some of those holistic treatments, because I think it's very forward facing and very innovative.
Yeah. Well, yeah, definitely. Thank you for having me. It's nice to be here again. And yes, when we think about it, we talk about like depression. There's so many treatments, our traditional treatments, medications, and being in that field, you do try it because medications do work for some people, and some it doesn't work for them, or they have really bad side effects that it's just unbearable at times, and or we have to do multiple augmentations in terms of the medications, which we have to do sometimes, and it works for some and some it doesn't. But we're thankful that the FDA has seen that this is an upcoming and trend, and as far as when we look at the treatment of depression now, TMS, as we popularly call it, or transcranial magnetic stimulation, really is more now like they're looking like as the second line of treatment for depression, anxiety, OCD, which was FDA approved most recently, I think last year or so, with TMS. And so we're so excited to see this because, again, you're not worried about side effects with medications. A lot of our medications cause they're great, but they have side effects, weight gain. We see that. And it is compounded on the depression, their self-esteem, things of that nature. It's a no downtime, non-invasive. So you literally come for treatment and you get your treatment done and you can get right back in your car, head back to work, or, if it's your lunch break, and it's short. And so it's really exciting just to see this trend because we know that right now things are hard, emotionally, people are going through a lot. I think since the pandemic, there's been a shift and we've seen that, people are going through a lot of challenges. Not just, we talk a lot about burnout. We talk about the challenges that comes with that. And so having this innovative treatment available for patients is just amazing, and just to see their treatment, when you see them come in and by the time they're completing their treatment, it's just a total ball game. And we have great reviews and we're excited, and it's going to be something that I think we're going to be hearing a lot more about, because it's here to stay. And I think at the end of the day, what we do want for a patient is for them to be whole, be able to enjoy it, look forward to enjoy their families, enjoy their careers, enjoy whatever it is that they set their minds on. And I think that's where we are today. So I'm just excited to be a part of that.
So when you talk about the treatment and feeling better, how many treatments does it take to get to the therapeutic effect? Is it after one treatment, there's a noticeable difference, or is it multiple treatments?
So the treatment actually on its own is 36 treatments for depression, and it's usually five days a week or more based on what practice you're working with. But it is 36 treatments. that you have to, attend. And so we begin to see noticeable anywhere from at least mid-range. So I would say anywhere from at least 20 treatments. Patients begin to report feeling much better. They're noticing. And again, it's not going to be a huge thing. The fact that you can actually wake up in the morning, shower, that could be the first sign you're noticing, right? Or
Mm-hmm.
I got my hair done, or I thought to make that phone call to my sister who naturally I would just look at her text and just, turn the phone aside. Those are the subtle changes you begin to see. And before you know it, by the time you're towards the end, they're asking you questions that in past time when you actually consulted with them, it was just hard to elicit, just it was that struggle, that, very despondency that you notice, or despair, or just very sad, hopeless feeling that they continue to exude. And so by the time they're in that stage, 2025, treatments, you're seeing a whole new outlook on patients. And it's so rewarding to see this. So yes.
The, I think one of the things that I'd be excited about for this treatment is its application for physicians and people in mental health, especially therapists, psychologists, because I'm remembering when it's always time to renew your license, and it has those questions
Mhm.
about, whether or not you're taking medication, and it's I've known many people who have been very afraid about, like, what are the implications of me saying that I have medication? Will I still be deemed as competent? And this is a way to answer that completely honestly and not have those side effects of medication.
Yes, the stigma with mental health remains, and especially for physicians, because you have to disclose a lot of things. I know we're always working with our licensing folks, but hey, as much as we can, again, for those who try medication, it has failed them. This is the next step in terms of treatment for them, and it's available. And again, we have patients who have started, who have been on medication and have actually gone off medication as a result. And so, yes, if they're having to answer a question on their boards or licensing, they at that point in time, they're able to like say, I don't have anything, and that is amazing just to feel that feeling, and just not feeling like, oh my gosh, what are they going to do? What are they going to say? How many more questions do I have to answer as a result of this? Or, is there going to be a rejection, or, whatnot, as a result of the stigma associated with mental health, for especially for professionals in the healthcare field.
Absolutely. I know when you look at some of the statistics and you have the number of mental health professionals and physicians who are suffering from burnout, depression, anxiety, and they're just knuckling through it because they don't want to get that treatment because the stigma is so high, and the possible ramifications, the fear of what can happen. Would anyone need to retreat those 36 treatments again? Or I saw that there were changes in the brain imaging. So how long
Yes.
will it last?
So every individual is different. So every treatment is individualized. So we have patients who have actually had multiple treatments. So you can have up to 2 or 3 or 4 in a year. We have those who have had only one treatment and they've been good even up till date at 3 years, and they're, off medications and doing well and succeeding in their careers and their life. So again, it's hard to say who is based on, of course, the initial presentation, the history behind it, and this, all the other external and multiple, factors that actually play a role, with depression, anxiety. So you cannot, there is no one box fits all. It's going to be based on, okay, let's see what you are, what's going on with you, where you are, and then just take it from there. But there is the ability to retreat. And the great thing with this particular treatment is it's covered by insurances. And so,
Wow.
yeah, so it's not just, that's the first thing people say. Yeah. So, okay. So how much is it? So, the great thing is insurance does cover it. You just have to make sure that your provider is credentialed with those insurances. So, but yes,
Oh, wow. That's very important for people. Are
yes.
there any people that should not get the treatment?
So if you have, I think, a history of brain aneurysm or coils, when you already have like any kind of magnetic, any you had, of course, neurosurgery, and then you have like either a coil placement already in your brain or aneurysm. Those are the things we worry about because, again, it is a magnetic machine, and so it's a device, and we don't want to displace anything that
Right.
already was placed in there. So those are like, really that would be the first and biggest most concern. History of seizures would kind of be based, and we'll monitor that closely. It's not all ruled out. It just depends on, of course, the history behind the seizure, how current, how recent, where you are, last. So it depends on quite a few things,
Right.
which of course we do, complimentary consultation and can get that information across. And we know, of course, what we're targeting, what we're looking forward to, and what we're actually examining at that point in time.
Is this a treatment that's widespread throughout the country, or is it still relatively new and being adopted by
I
physicians?
think it's relatively new being adopted, but I think we've definitely increased the trend, definitely since the pandemic. I mean, this was FDA approved, I think about almost about 7 years now, if not more. And
Oh,
so
wow.
it's just a matter of like everyone getting onto it and grabbing and saying, hey, it really is helping. And we use a Neurostar here, which has, 83% in terms of like, the absolute response to it. And then we're looking at 63% as far as remission rate. And so it's really great. And we're really excited to see what's going on right now.
This is really exciting. So I'm curious because you talked about some benefits in everyday life. Do you feel like there are some implications for those in leadership and those in the workplace? Like, what benefits do you think that they could receive from this?
Oh, yeah. So we know that, of course, people are depressed. They're having to go to work, because you have to work, right? But they're kind of going into work, and you're going through all this emotions, turmoil. I mean, they're seeing their therapists, they're seeing their coaches, they're seeing their doctors, all of these things just to kind of make it through, deal with whatever it's anxiety, deal with their emotions, their whatever it is that they're going through. And so this offers that ability for the patient to actually look into, like, okay, I have the opportunity as in leadership, I can take time off. You're talking about like 20 minutes in a day, right? To take
Wow.
time to really get treatment. Because what are we talking about here? If you think about medication, most of our medications takes 10 to 12 weeks to get to therapeutic level. You're talking about a
Mhm.
treatment that lasts about 7 weeks. So,
Wow.
yeah, if you had to do the comparison and then you don't have to worry about side effects, I mean, what's not to do? And I always say, if you look at it and think about tomorrow being a better day, there is absolutely no reason not to give it a shot.
Mm.
As if you've gone through, I mean, and the reality is people are going through so much. You've been depressed. You didn't just wake up and you were depressed. It's been going on for a while. If you didn't know what it was, you started out probably in the burnout category,
Mhm.
stressed. I'm just always tired, doc. I just can't put my finger into it. And before you know it, of course, productivity at work decreases, and you're getting reprimanded or whatnot at work. It's affecting your life, your marriage, your children, everything. It's a ripple effect. So what are you looking for? Why do we not pause here? Why do we not stop and say, hey, we have something that can help you. It can really change your life and transform, and that's what our goal is. And one of the key things and factors is not just, again, for our physicians, for our leaderships, for those in leadership, for professionals. This is for everybody. There's no not nobody is there's no, I guess, in terms of receiving treatment, that this is for all. And so I think that's really something that is very exciting. And I think for us, one of the approaches is we're mindful. And because I know only approach it from, I kind of really going from a holistic mentality is I'm looking from the internal, and we say if you feel good, right,
Right.
you begin to look good, right? So if you feel good, you have the ability to talk about self-care. People at times, if you don't feel good, it's out the door. Shower is the first thing that goes. Your hair, your things that matter, that just little things, like you wouldn't even take time to do it. You're like, you can't be bothered by that. And so we're trying as much as possible to get you back to that place where you were successful, you were happy, you were accomplishing. And it's a process, but this definitely catapults it. I look at it as a great jump start that kind of gets you, and you're oozing through, and then maintenance. And so we're really excited to see, again, the positive results we've been getting. And so if you're out there, someone who is depressed, definitely reach out to us. It's very exciting to see the positive outcomes we're seeing with treatments.
I think you bring up such a good point when you talk about uh, just since the pandemic, and we're seeing, especially in mental health, we're seeing so many people who have never gotten treatment beginning to get treatment. And you stated something about getting back to their essentially their best selves. And I'm seeing a lot of people who have never known stability and
Yes.
have never had their best self, and just I imagine them beginning to get one of these treatments and just almost like they were blind and now they can see.
Yes. It's a light bulb. It's a light bulb. I mean, really, your life is transformed because you begin to do things you couldn't do before. I mean, I have like patients who I know her daughter had a baby, and she's just not been that person to reach out. She couldn't even be the grandmother she wanted to until she started treatment, and now all of a sudden she's sending pictures of her grandbabies to me. It's almost like, oh, okay, this is a different person that I'm thinking I'm relating to. And from when you had that initial consultation to just seeing the progress, we're talking a year out, and this is like, wow, it's just phenomenal. Just to see that continuous progress, and then you continue to see that. I'm just excited that this is available, and I think everyone should definitely get on board with it. It's nothing to hide, it's nothing to be afraid of. I always say, we want to break the stigma with mental health. It's here. We know it. I think our Gen Zs are on top of it more than, the older generation. And
Absolutely.
so we really want to kind of be at the forefront because it's a healthy you. It's a way of saying, I am healthy and I should be healthy. And this is what healthy means, taking care of my mental health. And there
Right.
should be no shame about it, in getting treatment, receiving treatment, no matter what form of you'd end up choosing. There's, of course, medications are not going away. They'll always be there. And, we don't necessarily say we're coming to stop your medication with treatment. No, that's not the goal. It could be we're enhancing or augmenting, and that's the goal.
Mm.
And most times patients do well with both. Some do well off of it eventually, and they're able to get off their meds. So it just depends. Again, there is no one size fits all. It is just a matter of who you are, your story, your history, what challenges you've gone through, your stressors, and then we identify it, and then we just keep working with you on that. It's I look at it as a really complete treatment and wholeness because it's not just one thing. We are addressing every little area that pertains to you because, again, like you said, we want them to live their best life.
So, and when I think it's a aesthetic plus mind MD, right?
Hmm.
So I love the fact that it's a holistic approach because you talked about weight management, because that's one of the coping skills, right? When you are burnt out, when you're having mental health, to reach for something to eat and get those comfort foods instead of actually addressing the problem. Uh, I think that definitely happens to a lot of people.
Yes.
Now, how do you all treat weight management?
Yes. So, I mean, way before our GLP medications came out, like the Wegovy's and now the Zepbounds, Ozempics, we were doing treatments. So there are other medications that have been in use. We have our Contrase, Ventamin. Of course, you want to do a healthy analysis of the individual because we want to identify who you are, what the issues are surrounding it, and what is actually causing that, habit in terms of the way that you have the emotional eating and how you approach food. What does food mean to you? Because when you talk about, the whole idea of we're eating because we're fitting into our dopamine. These are the neurotransmitters responsible for our pleasure. And so
Right.
when you eat, it gives you pleasure, even though the situation at hand is just it's down. It's that you're depressed, you're feeling low, you're feeling sad, or whatnot. And so by eating, it satisfies you. So there are different levels of of pleasure that people experience, and so food is one of it. And so we want to identify, first of all, what is the situation? What is the background behind that? And then, of course, we have medications we offer. We have, of course, nutritional guides, exercise,
Okay.
things that you cannot, it has to be everything encompassed. And that's because we know that, I have patients who've completed bariatric surgeries and they've gained all the weight back because you didn't maintain, you didn't either exercise, you were not paying attention to, and now you've gained all the weight back. And so what do we say? Oh, that's it? No. So we just kind of retrain them. We train you because we want you to understand that this is a lifelong journey and battle. There would always be situations and stressors that would always come up, but how you handle and deal with those things is important. And so for us, we do approach, of course, with that mentality, again, addressing the mental piece, incorporating exercise, incorporating dieting, and then, of course, healthy habits. I really don't like to call it dieting, but healthy habits and healthy choices. Because when you say diet, people run away. They're like, oh my gosh, I cannot stop. I want to eat this and I want to eat it, but
Right.
how can I eat it and eat it healthy, right? So it goes to portion and, control. And I think that's where we address. And then, of course, we have our medications, the GLP medications. So the Wegovys, we have the semaglutide, tirzepatide, that we offer with our patients and work with them on and to help them attain their goals. I always tell them that, look, this is a jump start. Nothing is permanent. You're not going to be here forever. But it's a jump start. If your car breaks, the battery is out, you need that jump start. And it helps you because by the time you begin to lose the weight, you begin to feel good. You become excited. You things that you couldn't do before, you start doing it. And it's a good reason to go shopping for a new set of clothes.
Right.
So those are things that you kind of see you just begin to see the change and the mindset. You see the joy that begins to, and now they can actually have more energy in terms of exercising. It's
Mhm.
there's a you're changing the way the habit is, habit formation from, and I always say, like, in the first 21 days, you're just here habit forming patterns. But by the time you're hitting 90 days, you're beginning to like learn truly, like, okay, this is what healthy looks like. And so
Right.
healthier choices. And we work you through, through that process, until you get to your goal, your results. And then, we do maintenance and then we address it based on that.
Now, have you ever gone to um, how do I put this? Address if there's any body dysmorphia, and I asked that question because I remember I would think I was in my 30s and I got a breast reduction, and I remember it was nice the things that I could wear,
Mm-hmm.
but it did not feel like it was my body for the longest time. And there was this
Just,
mourning and depression. Uh, and when I think about people losing massive amounts of weight, like
mhm.
that's sometimes that's their layer of protection. And that's how they kept things away. And then here you've got this new luscious body.
I
So, do you ever
definitely
see
see
that as
that.
an issue?
Yes, no, we definitely address that. And that's why, we do a consultation. So to kind of understand where you've come from, what's going on behind the scenes, is that you didn't just wake up one morning and yes, you want to lose weight. There's been something going on. How did you get here? What have you been doing? What other approaches have you attempted? And so that's really important for us to understand. I have people who have like binge eating disorder or, and we want to understand what is behind it, what is setting that up. Because even if you start the medications, the minute you stop, you're going back to it if we don't address the culprit. And so that
Right.
is the key with that. With body dysmorphic disorder, we have to again address what the culprit is. What is the issue behind it? When you talk about the added layer, it's only normal. It's going to take you again. You have to figure out, this is who I am, this is what I have been, and this is the healthy me. And I always remind them, I said, the end of the day, what we're actually striving for is a healthy you. Because we're seeing, of course, with weight loss, we understand that you're helping in terms of your cardiac, your cardiovascular, the ability to live longer, right? And live longer in a healthy form is what our end goal is at the end of the day, to being healthy. So that is really when that is the end goal in mind, those little things are addressed. And that's because we've addressed the initial culprit. And so we are able to disconnect that phase, which is, oh, I just lost weight and I don't know who I am. Versus,
Mhm.
no, we know this person here was dealing with this, and this is a different person altogether who's
Right.
understood, like, food is not the answer to this stress that I'm going through right now. But okay, maybe I can journal, maybe I can pick up a call and call my therapist, or I can call a friend and say, oh, we need to talk to handle whatever the situation is. So you've learned to disconnect who I am and what led me to here, to
Right.
now I'm here, and this is a new body, but this is the healthy me body. And so it's not just one process. So we don't just say lose weight and hey, on Zoom and you're on your own. our goal is, okay, so what's going on and how can we help you? And, so it's really a comprehensive approach to really help him, because at the end of the day, it's not just about looking good, but it's
Right,
about being healthy. Again, and that's a really, really important one, because people are used to their bodies and this is who I am, and all of a sudden I'm not this person. I've had a patient who's like, I lost so much weight, I don't like how I feel. And the issue was not so much the weight, but there are other extenuating factors that we had to address. And
right.
so, with whether they were 200 pounds or they were 150 pounds, they were not happy. So it had nothing to do with the weight. They
Yes,
had other issues that we had to address and deal with. And so, it's always important to understand that, is it just weight loss? Or is it just the weight? What is behind the weight?
absolutely. Now, I mentioned before about just transforming your mindset and your beliefs about who you are based upon your body. I think that also, and I'm curious if you agree, that it is a challenge for those around them, whether it's in the workplace, because they may gain more confidence, they may be a little more assertive, or the way family members and friends react to you differently. Like 600-pound life is one of my absolute like guilty pleasures. Like I love watching this. And when you see the people, they start to make this weight loss progress, and then there's somebody in their life who keeps trying to keep them heavier and returning to those unhealthy habits. Have you seen them have a lot of challenges with those around them?
Yeah, so it's not an uncommon place to be. And that's because people are used to who you are and they don't want you to change. Not necessarily because they don't want you to change, but they don't know how to deal with the new you. And so you can't change anybody. You can only address yourself. I always tell people in therapy and sessions is, you're the one here right now in this seat. So it's
Right,
all about you. If there are other issues, what can you do to bring yourself out of that situation? You can't
right,
change that person, what the person thinks, how what they say, but you can change your response. You can change how you feel and what you respond with. And so with situations like that, sometimes it's not necessarily all like that the person doesn't want them to succeed or excel, but they're just not comfortable there.
mhm.
This is you're a different person, and I don't know who you are, and I'm trying to understand who you are. I can't remember the name of the movie with Andy. I think it's Andre Garcia. I don't know if you remember when he had the wife and she was. Um, she was sick and then she became healthy, and he couldn't deal with the fact that she was healthy, right? She was able to take care of
Oh, I'm going
herself.
to see this. I love Andrew
Yeah.
Garcia.
And I think, and so I mean, he loved her when she was sick. He was there. He took care of her. So that again has to do with who that individual is. They're a carer. That's all they know how to do. So
Right,
they can't deal with individuals. So that might just mean that the person who you have now become because of your confidence, being able to be more assertive, being able to do things that you were not able to do before. It's a
right,
positive thing, because remember, if you always remember and say in the back of your head, this is the healthy me, it changes the perspective versus, oh, I am just hot and skinny. No, that doesn't do anything for anybody, because you could be skinny and not healthy, right? And so
absolutely.
we're not looking, we're talking about health. We're talking about health, and we say health is wealth, because if you're healthy, then you can do things that, you want to do. You can accomplish your goals, your visions, your dreams. With work, there's more productivity with that. But if you're not, then you're not able to do all those things. And so that, puts you in that disaster for that occurs, because it's a ripple effect. And so we see with that. So again, for that individual, you're going to have to focus and look at it as, this is me, and explain to them, because these are your family or mostly your friends. Of course, there will always be some who will be jealous. You can tell them to jump on board, come talk to your therapist and get on board and get healthy. But you cannot stop people from being who they are. Some will be truly happy for you and
Mhm.
encourage it, and some will not, because they can't handle that new assertive individual, that new confident. They prefer that person who always looked up to them and they were the one who were shining. You can't
Right.
stop that.
No, you
So
can't.
the goal is to remember who you are and why you're doing this. You're doing this for your healthy you.
I think one of the saddest things that I've seen is I won't say it's a bad thing because it's appropriate in some circumstances. And we talk about we're at the top of the new year, new me. And these are all the people I'm cutting out in my life because we haven't, boundaries are nice, but
Hmm.
coping skills and communication skills could solve some of these things. And sometimes we fire people or avoid people who we just need to communicate a little better.
Yeah, that is
Oh,
um, that is a tough one, and I definitely agree. 2024, we're here. Of course, if we talk about resolution, I say no resolution, just start. There is no need because we say that every year, but what changes? So I just say just start. You want to do
mhm,
this, just start. And then just again be what I say. I think about it as be nice to yourself, be realistic with yourself. Don't set unexpected, or your expectations are unrealistic, right? Don't do that. Be realistic because at the end of the day, you want to accomplish it. When you accomplish a tiny goal, it actually
mhm.
motivates you to do well. If you set a like a goal that is like all the way up here and you're not even able to get to a quarter of it, there's that downer. You just feel disappointed in yourself, and it's like a negative ripple effect again. And so you want to be mindful of things like that. So expectations is so key. Just think about it as I love myself and I want to be nice to myself. People forget to
Right,
be nice to themselves. So I always say you have to treat yourself well. Nobody
right.
is going to treat you well if you don't treat yourself well. And so
That's
it really does make a difference. But top of the year, you want to look good, you want to be healthy, you want to in terms of boundaries, set boundaries for those who are negative in your setting. Communicate. The communication is always going to be key, and there's some people you can communicate with and there's some you cannot. And in those
right.
cases, you have to protect yourself, because part of the reason why you hear boundaries a lot is because it could be a negative effect on the individual, especially if they're for example, introverts, or they just don't know how to handle it. They're already dealing with a lot of anxiety, and you're compounding upon it. In that sense, it's very important to separate yourself from that kind of toxic environment as
Mhm.
much as you can. But again, when you think about it, I always say you're always the only person, the factor in there. So, is there a different approach that you can use? For whatever that situation is, because you are the one there who has the power, singular power, to change the dynamics of that relationship or the situation.
Right, right. Because a lot of it sometimes is fear based. I don't know who this person is, and will I lose them? I let me get back my loved one who was heavier or who was depressed, and I got to take care of them. Like I said, they don't know what to do with it. I'm really curious because I know you are also double board certified with addiction, and I'm thinking about depression and weight and addiction, and it's where does someone start first? Like, or do you do a holistic all at one time approach?
No. So again, you started a consultation. And first, we hear what you're saying, and you have to make your needs known.
Mhm.
We hear between the lines, but we hear the main reason. Like I had someone come in and they're this and they're that. At the end of the day, everything was surrounding weight, 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 weight. And I'm like, okay, so if we took the weight out, is this person still here? What would that mean? What would that mean? And so it's going to again be an approach, a consultation where we get more information, understand who you are. And because there's just so many factors that actually contribute to this. Yes, if it's just one thing, which is I'm anxious, you want to identify that, you want to deal with that. If there is substances, because again, anxiety, depression leads from self-esteem issues. Then you have negative coping skills with alcohol use or other drugs. These are all negative coping skills that the person has adapted because your dopamine center, which is the pleasure center, is telling you that this feels good. So we have to make that disconnect there, and so we approach that, of course, with treatment, and the various treatments for the various drug use disorders that we have. And so again, it's going to be, and that's why you have a consultation first. But of course, you have to come in. You come in and you tell us what is the first thing that you're most concerned about, and we listen to you and we take it from there. And then along the line in the conversation, there could be other things that come up, And as you go, and then, we have TikTok today. There's so many people come in and they ask billion questions based on what's on TikTok. And okay, so if I do this, will this happen? Will that happen? And I crack up all the time. I'm like, my goodness, we're in a TikTok medical medical.
Don't even get me started. The one that always gets me is the narcissists who are teaching people about narcissism, and they have this large following. I'm like, oh,
Oh my gosh.
we're just feeding this disorder. Like, what are we doing?
Oh my goodness. Oh my
If they
goodness.
are actually narcissists, I don't know. But everybody is a diagnostician these days.
Dr. Google, Dr. TikTok, I say it all the time. Like, just be mindful where you're getting all this information from. So we try to stay, of course, on top of everything, but it's interesting the things that come out and
Right.
the questions that come through the social medias as well. But I mean, I think the most important thing is you go to a place where you trust your provider, and that's really important. And of course, again, you bring your questions in, we answer it the best way. We do approach in the scientific with evidence, and so I think that's important for for how we approach ours. Everyone is different, but you have to go where you feel like you trust the person who is going to be giving you treatment.
And I really like that you said it starts with a consultation and what's most important to them, because I think that could be a barrier if someone feels like, well, I'm presenting with addiction, weight issues, depression and anxiety. I know they're going to make me get rid of this one, and I'm not ready to get rid of this one. So um, knowing that they can still drive the bus, I think is really important for any patient coming in.
Oh yeah, that's absolutely important. We're not there to, because if you try to impose your own ideas on people, they're not going to come back. And we want you to do we want you to do what is important to you. So we approach it. We're not working antagonistic to each other. We're working together, because we work together. We're more effective, and we see good positive results with that. So our goal is to work together. You're the driver. We're going to help you, get to your destination, safely.
What about in the case of, say, an impaired physician or someone whose board is mandated that they get treatment? My assumption is that, okay, we have to start here if you want to keep working.
Absolutely. That's a little different. So again, by the time they're coming to you, they've already had to go through like the physician health system. Is it PHS? Yeah, physician health systems. And so they are coming to you based on treatment. So they have to actually complete treatment. There are a bunch of criteria for those. And so you really want to approach it based on the guidelines that have been given, because, we want to work with you. We don't want you to lose your license. We know that we're all humans and we all have errors. We make mistakes. We're dealing with addiction. Addiction is a disease. It's no different from your diabetes, your hypertension. It's a disease, and it's a chronic disease. And so we want to identify what the situation is and how we can best help you so that you can get back to your baseline. You've, had to go through years of training to get to where you are. And we know that, whether it's from a family history or environmental stressors that has led to where you are, there is treatment available, and you can, get to that place of remission and get back into, being the successful physician or health provider as you are. But it just takes a lot of work, and there's always a great team in place to help people like that. So yes.
And it just dawned on me as you were talking, really your clinic is focused on all the things that come with such a heavy stigma to help people move forward, like addiction, mental health, and weight, like all the things that you can almost see people's faces when they hear someone has it or they see someone who's heavy getting on an airplane or walking by them. There's such a look. There's no empathy, and
Mhm.
it's almost a look of disgust. And so it's really difficult, I think, to want to get treatment and say I need help with this, because it's you're damned if you are this, you're damned if you get treatment for this.
Yeah, it's a tough place. But I mean, I think for me as an individual, I mean, I look at mental health. There's so much passion there. I didn't just go in, I didn't stumble in it. I really feel like it was a calling. I didn't just, I had an uncle who died by suicide, so I understand
Mm,
what that is. Also had addiction issues as well. And so my approach is always from that basis, which is it could be your brother, just because you don't know what people are going through. You see them, they look good, glammed, but you really don't know what's behind when you shut the door, turn off the lights, who is that individual? And that's where I said, if you really want to know people, you know them when the lights go out. And that's
mm,
really the truth, because then you really see the pain, the hurt, the everything that they're having to deal with. People present to you. I have people say, "Oh, I don't really tell you everything." I said, "I know, but I can't force you to tell me." And I'm not a psychic, I'm a psychiatrist. So I
right.
always have to emphasize that. Like, look, so I can read between the lines. I have my own intuition, and I can get my sense of like, okay, there's something off here. But at the same time, I can try to list it out of you, but you have to do that lifting for me as well. And so we're working together. I always say, like, we're here as a team. It's not just one person, so it's a relationship. And so we're supposed to help build each other, and I'm supposed to help you get to that next place. And so mental health is something that is definitely dear to my heart. I mean, I think I had a conversation just recently, and I was saying how we're supposed to be the most empathic because we understand, we understand. And it's not just the person wants to be this way. We understand the way the brain works. We understand
Mhm,
that there's just some neurotransmitters not connecting the way it should. We
mhm.
understand that trauma can totally change the life of anybody. I mean, we're
Absolutely.
talking about, like, you can go to bed today and you lose your loved one tomorrow. Your life is changed, and it's a ripple effect because everything changes. Maybe your standard of living changes. Everything, so there's always something, or the person who's been traumatized, abused, their life changes. And so you have to feel, right, to be able to understand where they're coming from, because when you do, there's a different approach. There's a different It's something from the inside that comes out, right? That you want to really help. I know as much as we do that, we can't help everybody. We
Right,
try, but we cannot.
right, right.
But you give it your best, and that is from my approach personally, which is I understand. And I understand because I understand what it's like to be on the other side. Having had that experience with my own family as well. And so it's not just I'm a doctor and I'm helping you this. And yes, you think I'm accomplished, great, but I also have family and I'm also human. And so I have my own, we have, when we lost our uncle, to by suicide, with addiction as well. And so these are real things and real factors, and people deal with that all the time. And so I personally understand what that means for the individual coming for treatment, that they want their lives back.
Right.
I do. And it takes work. And we hope that our goal is to kind of get you treatment, get there so you can actually begin to live that best life of yourself. Yeah.
Right. One that's wonderful, and empathy is extremely important. I think one of the saddest things that I've seen this trend of so many healthcare personnel, physicians, nurses, mental health people leaving the field because of burnout and a lack of desire to seek help and treatment for burnout, mental health, weight management, all of that, because it's easier to leave. And you think about all the money they've spent getting to this place and then they're leaving. Have you seen that happen at all? Physicians leaving the field?
Yes. Yes. We've had few physicians who've left and they've changed their courses. So maybe they were in like clinical treatment. Now they're not doing a lot of clinical work. They're trying to do more administrative kind of work, just because, clinical is there's a huge burnout with that. And it's just, I think since the pandemic, there was just a lot, every people had to go through a lot. And if people forget that, again, I always say, remember first, we are humans Yeah. Then second, we have a profession, right? And so it doesn't mean that we're exempt from the same emotional turmoils that everybody else is going through. If you lost loved ones during the pandemic,
Uh,
you're not immune from that. You go through the emotions with that. If your finances went down, or you had to, you were there, you saw, you were the last person the patient saw before you left, it's all of those things are real. So there's, how do you disconnect that? You can't. So you have to really pay attention to the emotions and those struggles. And so as a result, there is burnout. I think one of the articles I read. I can't remember when it came out, but by Adam Grant with Languishing, when he was talking about how people are just, they can't put the word on it. So is it burnout versus I just feel like blah. And I crack up because I'm like, there is that fine point there, and that blah is eventually what leads to burnout. Burnout eventually will lead to depression. And so that's what we tend to see with that. And so, these are real life situations that people are going through. As far as mental health, psychiatrists or physicians, there has been a decrease. People are doing more part-time work. They're getting out of that. I'm stuck with 9 to 5. They're going into things like locums, where they choose their time, and you
mhm.
have to do what's best for you. I mean, I think it's not always an easy decision, especially because you have family, you have responsibilities. The bills never stop, right? So you have to do what makes sense to you, but it's important that you do it not at the detriment of your health, because we've had quite a number of suicides that has come up in the past couple of years, especially during this pandemic and post-pandemic. And so it's really, people have really gone through a lot. And so it's important that we help support them, and not like, oh, you're giving up all this. It's not a matter of, person is not giving up. They have to take care of them first. And,
Right.
there, who is to say that they wouldn't come back? But at this moment right now, a good break is important for that individual. So it just depends on where you are. And so, yeah, we've seen that in just, changes in terms of career paths, or just going part time, cutting back on work, and then just, being more flexible and content. Because if you're
Mhm.
content, then you don't spend more. So maybe that could be another way to look at it. So again, there has been. So yeah, with that.
Yes, and it's so amazing that there's all this pressure on individuals to heal and self-care. However, we're placed in these sick systems, these these systems that aren't designed for the wellness of those that are giving care. They're sorely under supported. Um, that might be not a nice thing to say, but I feel like the system is designed to burn out healthcare professionals and those that have to be empathetic.
Yes. Mental health. I think when we were in residency training, we had one of the part of the being in training was you should have a therapist too, because you want to experience what it feels like.
Hmm.
Because it is stressful in residency, and so you want to understand where your patients are going through. And so even for a therapist today, they typically have their own therapist. That is the way it's been taught. So having someone who you also kind of rely on to help you, support you through the different challenges that you go through, because in life there will be challenges. It would always come in different forms of fashion, whether it's your career, it's your children, your marriage, relationships, finances, name it, something. There would always be something. And so it's a matter of, how do you cope with challenges? How do you cope with difficulties? How do you cope with in situations that come out? And so it's never ending. There's always going to be something. But I think the key factor is how you cope in that situation and that limelight. And that's really, I think, a key to address with that in that kind of scenario.
Right. You don't have to keep putting things in a box. You can actually experience the emotions. I know so many people sometimes feel like if they address the emotion, it feels like they're just going to fall apart. Like, I've been
Mhm.
putting this in a box for so long, I can't possibly open this box because it's going to jump out and overwhelm me. Okay.
And that's what's really what tends to happen a lot of times, which is you've been going, 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 and all of a sudden, pop. That's it. That's what happens a lot of time, and that's burnout, right? Burnout, you're burnt out, you're tired all the time, and one morning you just can't get out of bed.
Right.
And that's the end. Everything begins to change right from that moment on. And so it's, if we're already taking steps daily, which is, and I think we all know this, but we just have to take, those time off, take a vacation. And vacation doesn't mean traveling out to anything of fancy, expensive. It just means
Right.
take time out for yourself.
Right.
Figure it out. If you have to go, just go somewhere, go for a walk, right? Lock yourself up somewhere and just say, this is me time, just enjoying whatever it is I'm enjoying.
Right.
Just take that time for yourself. You create it. It doesn't have to be anything big or anything that takes you out of the norm, but just taking that time to reflect, to like reason, journal in a book and say, what am I doing? What are my goals? What are my visions? Kind of come back to that place in the drawing board and say, who am I? What
Right.
am I doing now? What are my goals now? What do I want to be in 5 years? What do I want to be doing? Where do I want to be? What is it? So again, you want to be realistic. I cannot, stress that enough. Be realistic with your expectations, your desires, your dreams, so that when you're putting that down in paper, in writing, it makes sense and you can actually attain it. You can actually say, okay, I can do this.
Right.
You have to be nice to yourself. You have to be nice to yourself. If you're not, and people forget to be nice to themselves. And we, as physicians, providers, we definitely forget to take time for ourselves. I always ask, when was the last time you went for your physical? Like,
What? Take care of myself? Are you
yeah,
crazy?
yes. And then
And
the only time they do that is when there's something like, oh, something is wrong. Oh yeah, I should make an appointment. So
yeah, oh yes, my arm is making this noise. Time for me to
yes.
go in. And I think also not just goals, but just finding something that you just enjoy just for enjoyment's sake. I know I went to I don't know if you have this restaurant here. It's called Cracker Barrel,
Oh yeah.
and they have all of these old games. And I got Jacks in the Ball. And I just took it. This is a game I played when I was a very little girl, and I'm on the kitchen floor, and my kids are like, "What are you doing?" It's like I'm playing jacks, and they didn't understand it, but it was just a moment of just silly, fun joy.
And that's sometimes all that you need.
Mhm.
Gratitude, little things. I mean, they say if you list like 10 things every day that you're grateful for, you'll stop complaining.
Yes,
Your perspective will shift.
right.
It will change.
We do forget how
We forget.
what all we need to be grateful for, and what all blessings we have in our lives.
Mhm. There is this thing I read here, bite-sized tools for well-being, and I thought it was interesting because what it says is it's an exercise, and it says they tell like physicians to write down. It is a text program called Three Good Things that encourages physicians to send a text listing three positive things that happened during the day. And the
Mm,
exercise lasts like 15 days, and texters have access to others' answers as well. And based on this study, after 3 months, the participants actually baseline based the depression on gratitude and life satisfaction significantly improved. And so,
wow.
and their meaning behind that is we forget because we focus on all the negatives. Did this go well? Did that go well? But remember, oh, that patient said you were the best thing that happened to me. You forget
Mhm.
those little things that should really be very, very impactful, but we
Right.
focus on, the person who was yelling or who didn't return your call or or whatnot it is. And so I thought that was really powerful when I read that, and I'm like, that is so important to, just take, every day, just do it. You don't need to be in any group or anything, but just be grateful for, just write three things, that you're like, okay, three positive things that happened to me today. I mean,
Right.
and just set a keep account of it and read it every week and be like, wow, it's not all bad.
No, it's not all bad.
Yeah.
Well, Dr. Tola, I am so grateful that we had the pleasure of your company and your wisdom, and to hear all the wonderful nuggets of insight. Is there any last thing you'd like to share with our audience before we leave?
Oh, yes. Well, thank you again for having me. I think for, if you know anyone who is suffering from depression, anxiety, definitely have them seek help. Never discount what the person is going through. not the physician, not the psychiatrist, encourage them, be that friend who gets them to the providers, to their mental health specialists, doctors, off, to get them there. That is what your role is. We have to all remember that it's, how it says that it takes a village to raise people. And so right now, we all want to really help each other, because the rates, I always say, like, we're increasing number rates of suicide, and so that needs to break. We want to break that. So if you can find that someone who is suffering, or going through challenges, get them the help they need, even if they won't go with you. Help to offer to help them. And so, and I think that's really important today, just to get help, and let's break stigma with mental health.
Thank you so very much. I appreciate that. And until next time,
All right, thank you so much. Thanks for having me.
you're welcome. Thank you for tuning in to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson, and you can find me here every Thursday, 5 p.m. Eastern, 2 p.m. Pacific. And until next time, I'll see you next week.